Hey everyone, today we'll be taking a look at the top 5 mistakes people make when it comes to managing their tendinitis symptoms. So let's take a look. So what is a tendinitis exactly? A tendinitis is a condition that refers to inflammation of your tendon. It falls within the tendinopathy spectrum, which is a spectrum of disorders referring to any type of repetitive overuse injury of your tendon. Now, a tendinitis can apply to any tendon in the body, so you could get hip flexor tendinitis, biceps tendinitis, triceps tendinitis, patellar tendinitis. Literally any muscle with a tendon can get tendinitis. Because this condition is an overuse condition, it can be very frustrating to recover from. Mostly because the things and activities, whether it be your work or the sport that you're playing, that cause the injury to occur in the first place can re-trigger your pain to occur anytime you try to do those same activities again. Let's move forward. We're going to start with mistake number 1. The first mistake that people make when they're dealing with a tendinitis is that they tend to just stretch that injury. While stretching has been shown to help improve these type of conditions, when your range of motion is actually already full, there is little to be gained thereafter. When you're doing your stretching exercises, they're still going to feel good to do, and by all means keep doing them. But if you limit your exercises to just stretches, then you're not going to proceed with your recovery. You're going to put a hard cap on how good or how much recovery you'll actually experience. The problem is that stretches don't do anything to increase your tendon's ability to handle more forces. It won't help your tendon become stronger. It won't help your tendon to become more resilient to those movements that still trigger your pain. It just doesn't do much to make that tendon bigger, stronger, and better than it was when you got injured. Mistake number 2. Now this is the big one. Most people are very apprehensive when it comes to pain because, it hurts. And the number one thing that they end up doing is they end up stopping all activities that trigger their pain. Now, while pushing through pain might not be the most ideal scenario if that pain is very aggressive, if that pain lingers for multiple days, or it makes you feel too sore to move, you do need to expect that a little bit of pain will be experienced when you're doing certain types of exercises. This is because the pain that you're experiencing when you're doing certain movements is not always correlated with how much damage the tendon actually has. In fact, a lot of the time, your tendon could be completely healthy from an anatomical standpoint, yet it could be very sensitive to pain. Likewise, you could have no pain at all, yet a lot of damage going on through the tendon. This is why you shouldn't use pain as the only metric when it comes to whether or not an exercise is going to be good or bad for you. This is also why we usually recommend that you're working together with your physiotherapist or sports chiropractor so that you can actually understand which exercises are really good for you and which ones might be too much. But if you don't have access to a healthcare provider right now, here are some tips that you could take away so that you could kind of understand when you're pushing through too much pain and when it's okay. Generally speaking, when I'm working with my patients, I usually tell them to follow the 2-2-2 rule, okay? And the 2-2-2 rule basically is just a general outline that you could apply to most tendinitises so that you can understand whether or not the pain is going to be a little bit harmful or if the pain is just totally okay for you to experience. The first aspect of this 2-2-2 rule is that you shouldn't be pushing through more than 2 out of 10 pain. Now, some exceptions do apply. There has been a study that came out that showed that pushing through up to a 5 out of 10 pain can be acceptable for something like Achilles tendinitis. While the study was published for this one tendon, it hasn't really been shown or reproduced for all the other tendons in the body. I like to err on the side of caution and tell my patients, hey, if it's a 2 out of 10 pain, or I like to call it discomfort or less, that's okay for you to experience. The second 2 that you need to really realize is that you're not experiencing increased pain or discomfort for more than 2 hours after you finish that exercise. If you find that the exercise did flare up your symptoms for more than 2 hours, it just means you pushed the exercise a little too hard. Now, it doesn't mean that you will reset the progress that you've made. It just means you kind of reinitiated the inflammation cycle, and so you're going to need some time to recover from that. But it doesn't necessarily mean that you did damage to the tendon. The other rule of thumb that I like to follow, this last 2 of the 2-2-2 rule, is that you're not getting more pain 2 days after the event. So today and tomorrow, or the day after, the symptoms that you experience aren't flared up. Now, it's also important to realize that while you're doing these exercises, that you are taking what we call relative rest from activities that cause your aggravation of your symptoms. So If you get knee pain or patellar tendinitis pain because you were playing soccer, taking a short break from soccer might be needed for you to get that recovery gain needed from the strengthening exercises that you might be doing. This brings us to the third mistake that people make, is that they don't push hard enough with their strengthening based exercises. And a lot of this has to do with point number 2, and it's because a lot of people are afraid to push through pain. And while you don't want to be pushing through too much pain, you do have to make that tendon work pretty hard. When it comes to doing your strengthening based exercises, eccentric exercises or isometric exercises are preferred over concentric exercises. And this is because of a phenomenon called time under tension, which is the fact that tendons respond a lot more to slow loading of the tendon rather than fast loading of the tendon. When it comes to doing your strengthening exercises, you do want to push up to a 6 out of 10 RPE or rating of perceived exertion. Basically, this means that when you're doing an exercise, it should be at a medium to medium high intensity so that you can stimulate your muscles, you can stimulate your tendons to actually grow stronger. Now, it's important to realize that you want to keep in mind the 6 out of 10 RPE and that 2 out of 10 pain level in check. You're going to use both metrics to understand whether or not an exercise is too aggressive or too easy or just right for you. All right, so mistake number 4 is relying too heavily on what we call therapy or treatments. Now, a lot of people will go to see their physiotherapist, the chiropractor, the massage therapist, you name it, to get some pain relief. This can be in the form of massage therapy, myofascial release, scraping, acupuncture, whatever it is that you're doing for pain relief. What happens is people end up relying too heavily on this for the short-term relief, and they do not prioritize the exercises needed for that long-term recovery and strengthening. Now, patients aren't the only ones guilty for doing this. Some clinicians, some therapists may also be guilty for doing this by relying too heavily on the pain relief aspect and not enough on the long-term recovery and strengthening aspect of your program. So if you are seeking therapy or you are getting treated at the moment, please be sure to ask your healthcare provider for some strengthening exercises that you can do to start working on that long-term gain and recovery of that tendon. This brings us to our final point, number 5, which is stopping your exercises too early. Now, as I mentioned earlier in this video, when it comes to tendinitis or tendinopathies or tendinosis, whatever you want to call it, pain is not associated very well with the status quo of your tendon. What I mean by this is when you're doing these strengthening exercises and when you're progressing through and you're leveling up the tendon and the strength of it, the pain will eventually subside to the point where you won't feel any pain at all. And at this point, most people are like, I'm good to go. Let's go work out again. Let's go run again. Let's go play soccer again. But hold up. As we mentioned, the pain might disappear, but there still might be some capacity issues in that tendon, meaning that the tendon might not yet be ready enough to go full throttle back into the sport or the job that you're doing that caused the pain to trigger in the first place. So what this means is that, generally speaking, tendons do take a while to heal and to recover. It can take anywhere between 3 to 6 months of continuous and consistent exercise for you to get to the level where you don't have to worry about the tendon anymore. Often pain relief happens at the 18-week mark, or if not earlier. So what ends up happening is you will feel no pain, yet the tendon might not be necessarily strong enough for you to do that activity again. And what people may experience is that as soon as they go out and play soccer and play that sport that caused their injury to occur in the first place, the pain will come back within a week or 2 of reintroducing high intensity exercise or activities. And then unfortunately what happens, a lot of people feel that they might give up on their exercise program because it feels like things just went back to ground zero. Now, the thing that you need to realize is that you return to your activity, you return to sport too early. And a lot of the time, patients aren't the only ones guilty for doing this. Sometimes patients are discharged too early because they are doing very well when it comes to their treatment program. Now, it's really important that you stay consistent with your programs. You follow up with your therapist or your clinician at least once every 2 weeks or once every month to make sure that the strength of that tendon is still leveling up and baseline testing is being made so you can actually objectively measure whether or not this tendon is strong enough to return back to your activities. As a general rule of thumb that I like to give my patients, I tell them, please be consistent with your exercises for an additional 6 to 8 weeks after the pain is gone. And from there, you can just kind of chill out. Now at that point, when I'm seeing my patients, I'm not really seeing them every week because they're doing so well, but we are checking in to make sure that they're on track with their gains. All right, everyone, I hope this helps to give you some understanding about your tendon injury and how to manage it moving forwards. A lot of the time, the frustration that a lot of my patients feel, a lot of the sensations or feelings of wanting to give up or that this injury just might last forever or stick with you forever often comes from not really understanding the injury and how it recovers and the natural history or the way it's supposed to kind of go. I hope this gives you a little bit more encouragement or confidence to keep up with your exercise program, because oftentimes a lot of people give up too early. You gotta keep doing those exercises until things feel good all the way. If you guys like this video, you wanna learn a little bit more about mistakes that you don't want to make when it comes to other types of injuries, let me know in the comments below. Please be sure to subscribe to my channel, and I'll see you guys next time. Peace.